Welcome back, guys. Now it's time to put in the work to correct this problem. Now that you've assessed all of the potential contributing factors to the sciatica, we can develop a plan to correct it. My name is Adam, proud father, married to an amazing woman, fitness enthusiast, registered physical therapist. This channel is dedicated to those busy parents trying to figure out how to perform at their best in this crazy game of life. This content was created for educational purposes and was not intended to replace medical advice. So step one, understanding if your body responds to a flexion-based protocol or an extension-based protocol. That will let us know what types of movements are going to help you the most. If you feel better with walking, you feel better bending backwards, you do not like sitting, you do not like bending, then you are an extension responder, which means you should avoid flexion or bending forward or sitting as much as you can right now. We want to take a greater ratio of extension to flexion throughout the day. Anytime you start to feel symptoms, we're going to do extension exercises or simply just get up and walk around. Number two, strengthen your core and hips. You want to do exercises that keep your spine neutral and your pelvis level when moving against gravity or some type of external force. For example, a dead bug, where you're laying on your back, you've got your hips up at 90 degrees and your arms are up as well, and then you alternate one leg and the opposite arm, stretching them out and bringing them back in. But the point of this is to maintain your spinal position and your pelvic position during this whole time. Trust me, it's not as easy as it looks. Another example is what we call a bird dog. In this case, you're on your hands and knees and you're doing a similar movement to the dead bug. It's like you took the dead bug and flipped it over. Now you're a bird dog. These types of exercises, it's all about quality of movement. So you have to be very conscious of how your body is moving. And if you can, have someone give you feedback or video record yourself so that you can see how your body is maintaining position. You also have exercises like side leg raises, where you're strengthening your side buttock muscle. That muscle called your gluteus medius actually will keep your pelvis from dropping when you're on that stance leg. Number three, you want to stretch any of these tight areas, especially in your hip. So we can do exercises like the piriformis stretch. The piriformis muscle is one of the lateral rotators of your hip. And this muscle can often be very compromising to the sciatic nerve because the sciatic nerve runs over, under, or in 10% of the population, even through the muscle. In this case, stretching that muscle can be very relieving. If you're just holding it and suffering, waiting for the timer to go off because it's so uncomfortable, you may not actually achieve what you want to. So the trick I have for my patients is to practice deep breathing while in that stretch. That will allow the muscles to actually relax. Another muscle that's very close to that piriformis is called your obturator. Your obturator, to stretch that, you want to grab your foot with the opposite hand and you want to turn your hip into an external rotation and then pull that shin bone, which is now perpendicular to your body, pull that shin bone towards your chest. You'll feel a slightly different stretch than the piriformis stretch. Another hip muscle that you may want to stretch is called your hip flexor or your iliopsoas. This is best done in a half kneeling position, ensuring that your pelvis is locked in and you are feeling the stretch up into the abdomen, the lower abdomen. You want to hold this one for 5 deep breaths. If you notice relief of symptoms doing these stretches, then this is really important for your success. The fourth one is to practice good posture. You want to make sure that when you sit and stand, you have good posture. So for example, if you are sitting in a chair which most of us have to throughout the day, then you want to make sure, if you are an extension responder, to maintain an arch in the small of your back. You can accomplish this by putting a rolled up towel or a pillow in the small of your back, making sure that your pelvis comes forward. This will allow that nice curve in your lower back. You want to do this also when you're driving. Pump up that lumbar support as much as you can, and then even add a towel or a lumbar roll to the small of your lower back. And let's say you work on a laptop, which most of us do these days, then put that laptop on the floor and lay on your stomach, propped up into extension onto your elbows. This is actually more comfortable than it looks. Try it at home. Another thing you can do is have it on a small table. I'm using here in this video a plyo box that has different heights depending on what surface or what side it is sitting on. So in this case, I can change the heights of my workstation. I can kneel, I can get into that hip flexor stretch. These are just ways to constantly change your position throughout the day. Very important. Number 5, sciatic nerve glides. So it's really important to keep that mobility in the nerve. The nerves actually don't like to be stretched. This is one of the main sources of pain. Doing exercises like this nerve glide exercise, where you're seated in a slump position, as you straighten that leg, kind of like that nerve tension test we did, you want to come up into a straightened position, bring your head up, and then as you bring your leg down, you can go back into the slump. This is actually gliding or flossing that nerve through the channel to improve that neural mobility. You should not feel more pain when you do this. If you do, then you're doing the wrong thing or your technique is poor. So make sure that you revisit this just to see if you're doing it properly. Lastly, once again, a bonus, guys, seek professional help. This video is only to educate you, and this is not to replace medical attention. If you have a trusted professional that can guide you through, this is the best option. Just because you have sciatic pain doesn't mean that there is not a potential more serious problem. So as a professional, as a physical therapist, I always rule out red flags, and I get the big picture through the assessment and the history, family history. There's so much more involved. So make sure that you're seeing someone who can properly assess you and then triage you if necessary. If you enjoy this content, please subscribe, like, and share with family members and friends that you feel could benefit from this content. It only helps to get more eyes and to help more people. Thank you for watching. Tune in next time. Got more videos coming at you.